to watch the seminar online tonight. So don't be too put off by lights and cameras, and the only thing it can see from any of you sitting here in the audience is the back of your heads. Just so that you know, nothing to be concerned about.
We get a lot of good questions from people all around Australia that join us for this. In fact, we have a couple of people in Hobart tonight that are logged on and are watching, and some down in Sydney and
oh, really? Yeah, there's some people watching online tonight from all around the country, which is great that they can actually, it's a great system because it means that they've got access to the information without actually having to be here. And once upon a time, people would, they'd fly in to watch the seminar and stay for a week to have their appointments, and now they can just watch online, which is pretty good. Yeah, it's amazing, isn't it? Where would we be without it? It's just incredible.
Lots of it, smartphone.
Yeah, I know. All the things that you can do on it. Yeah. What time is it? Yes, 6. Oh, is it already? Are you ready for me to start? Yeah.
We were contemplating doing a bit of a song and dance, but
Feel free.
Yeah, now she's started.
we were getting this microphone earlier and thinking we could do a little rendition of Mamma Mia or something, but we keep on threatening. Maybe one day we will. Although that would probably turn everybody off. Be walking out the door. See ya. Well, you know what? I can't do it around there.
I think I'll make a start. Thank you so much for your patience, first of all. And thank you very much for joining us tonight. Welcome. My name's Felicity. I'm the CEO of Weightloss Solutions Australia. This is a business that I've been involved with since its inception around about 14 years ago. So my lifelong passion and my my work's been dedicated to working on and managing patients and people who are looking for a weight loss solution when they've actually tried absolutely everything on the planet generally before they get to us, to find that one thing that is going to actually help them to transform their lives and to have a sustainable long-term outcome. And that's what we're really looking for. And generally most people, by the time they get to us, they've not only had issues with yo-yo dieting and fluctuating weight concerns for many years, but they're starting to actually see and think about the kinds of medical conditions that tend to go hand in hand with being overweight and also morbidly obese. And those are the real concerns that we need to address and that are the significant concerns for us when we're looking at what are we going to do to help our significantly increasing patient population that is suffering from having weight-related problems. And the kinds of problems that we see frequently are, as you probably know, type 2 diabetes, sleep apnea is very common, high blood pressure, and all sorts of other types of medical conditions, along with depression, etc., and the psychosocial type of diseases that we see related to patients who suffer from being overweight. And the exciting thing that we get to share and to see with our patients every day is that these are the kinds of things that we can resolve and see drastic change occur fairly soon after having surgery. In fact, for us, it's so rewarding because we see patients 6 weeks post-operatively who are already off their type 2 diabetes medication or reducing it significantly. If they've ever slept with a CPAP machine, they might be off their CPAP machines. They might be off their antidepressants, and those are typically the kinds of rewards that we see patients achieve all the time, and it's really exciting. And it's I think if I had $1 for every single patient who ever said to me, "I wish I'd done it sooner," it's just incredible. I don't think I know one person who actually hasn't expressed that to me. I'd actually just like to welcome our viewers who are watching us online tonight. We have people watching from Hobart, Sydney, and many other parts of Australia. In fact, tonight we've actually got probably one of the largest audiences that we've had on an online webinar. So it's exciting that people are joining us and they're able to access the information as you are tonight here in our room. So welcome to everyone online. If you do have questions, please fire away. We've got staff here who will be more than happy to attempt to answer your questions. So for anyone joining us tonight, we really recognise that this is a huge big step, and congratulate all of you for stepping out of your comfort zone and making the time and the effort, and really thinking that maybe this is something that you'll learn from and find an opportunity for you to address your weight concerns. So congratulations to all of you for being here and taking that step. Tonight, what we'd actually like to do is to introduce you to each of our staff, first of all, who are going to actually, one at a time, give you a bit of an insight into their roles within our clinic, how they work with you throughout your journey, and also what to expect, from each of the procedures, and give you the information that you're looking for and answer your questions. So make tonight about having any of your questions answered, and please don't hesitate to interrupt us at any time. If you've got a question, please ask. We've also got a couple of patients who are going to share their stories with you later on tonight as well. So I'll just actually introduce the team to you. Firstly, Carol she's a nurse with many years of experience and has worked with me in this industry for many years, and you'll get to know her on the reception staff team, and she's one of the team members who will guide you through the whole process. And tonight she's actually going to talk to you about each of the individual procedures, how they work and what to expect. Melanie is our patient relationship officer. Some of you might have met her when you were looking into attending tonight. And so not only does she have a role here on staff, but tonight she's actually going to share with you her personal experience of having had bariatric surgery. Taryn is our accredited practicing dietitian, so she's actually going to tonight tell you all about how food relates to each of the procedures that we offer, what to expect, what are the, how it all functions, and what to expect from each individual procedure. Michelle is a medical receptionist here, so you'll get to meet her also, and Warren is our psychologist team member here tonight. So you'll get to know each of our team eventually throughout the evening. But I might just start with Carol, who's going to actually give you a bit of a rundown on all the procedures. Thank you very much.
Thank you. Welcome everybody, and yeah, thanks for coming out. It's great to see people make the effort to actually take a step towards changing their well-being. As Felicity was just saying earlier, one of the things that we in the medical profession actually see is anybody who is to the overweight, to the obese or super obese, or whatever part of that category, actually impact on their health quite substantially. So it's not just about their body mass index, it's also about waist circumference, and whilst we might not take that measurement on a regular basis, the significance of that measurement is that it can increase the risk of heart disease or type 2 diabetes. And that's becoming more and more significant in our population. And the reasons behind it, I expect, are many, whether it's due to the types of food that we eat, or the types of food that we've grown up eating, or the overabundance of food. It's numerous, and each of us have our own story as to why we struggle. But it is a struggle, and we understand that. I guess one of the most important things is to really understand the medical problems that can happen with this overweight and obesity. And Felicity touched on the hypertension and diabetes and sleep apnea. But it can also impact on ladies who are trying to become pregnant, because it can stop their fertility. And we've actually seen people who have tried for years to become pregnant, and they've found that as they've lost their weight, they've become pregnant. And, you know, that in itself is such a joy. There might be other reasons as well. It's not a one size fits all, but it's so encouraging to think that when people take hold of their health and grasp it and actually run with the health aspect, it just changes their lives so dramatically. And the other thing that it can impact on is, and this research has shown that there is an increased incidence of cancer. There's back pain, there's arthritis, there is, you know, so many more illnesses and diseases that we can prevent or at least improve in our lives if you already have those. So some of our patients have type 1 diabetes, and their diabetes has improved significantly, so they're not taking as much insulin, or you know, and that in itself has to be a bonus for them also. So that was just a little bit of background about the health issues that are associated with overweight and obesity, and I'm sure everybody's got their own story, and no doubt everybody will have some little thing that it is impacting on their life. So I'd like to talk about, if I can, the main three procedures that we offer here, and I'll start off with the not least invasive or the non-invasive up to the other two surgical procedures that we offer. So as Felicity said, please feel free to interrupt or to ask a question as we go through. The first procedure that I'd like to talk about is called the Orbira intragastric balloon. It's classed as a non-surgical procedure, and just behind here I have what it looks like deflated. So as you can see up here on this diagram, the balloon is actually put down into your stomach via a gastroscopy. And for those who don't know what a gastroscopy is, it's the camera that goes down into your throat to have a look to see what your stomach is like. And then they can put this down into your stomach and then inflate it with some saline, and that then sits in the top part of your stomach here. And as you can see, it's actually taking up room in your stomach, so there's only a small amount of stomach left that you can actually put food into. The idea about the Orbira intragastric balloon is that it's in there for 6 months, and it can't stay in any longer because it's surrounded by your gastric juices as well, and so it is recommended at this stage. There's talk that they may develop one that's going to last longer, but for this time it's only there for 6 months. The program that we offer is 12 months, however, because once the balloon comes out, then you're back to your normal stomach. And so you need to look at making sure that those changes to your health patterns and your perhaps taking up exercise and dietary regime is then going to be consolidated in the next 6 months. And that's with working closely with our dietitian and our psychologist as well. So it's a great procedure. The amount of weight that you would lose with this varies. The average is around the 10 to 15 kilo mark. We have had one particular lady who lost nearly 30 kilos using this balloon. She is more the exception than the rule. We're very proud of her achievements. She didn't do anything different, but it just worked so well for her. And others, maybe about the 18 kilo, mostly it's around the 10 to 15 kilos though. Okay. It's removed exactly the same way as it's put in. So the gastroscopy is put, the gastroscope is put down into your stomach, and some graspers and instruments are used to deflate the balloon and then withdraw it. You're not aware of anything that's going on when this happens. Whilst it's not a general anaesthetic, you are sedated and you don't remember and you're not aware of it at all. Okay. The difference with this balloon is that in case something was to happen, I've never seen anything happen, I've never heard of anything happen, but they do have to be proactive and know that we've got to put things in place. What would happen if the balloon started to automatically deflate, and how would I know about it? The saline that they actually fill the balloon with is coloured with blue, so that if it was to start to deflate, you would know because your urine would become quite fluorescent green, and then you would know to contact your centre so that that could be removed sooner rather than later. As I said, it's not something that we've seen, but it is something that they have to take precautions with. Okay. The type of diet that you're on, Taryn will go through, it's pretty simple at the beginning. It's a couple of days of fluids, and before the balloon is removed, it's a couple of days of fluids. And it's a build-up from fluid to normal food within a short period of time. And then it's just about changing your dietary pattern and being able to eat smaller amounts and knowing that you're comfortable. You don't feel it inside. Personally, I've actually had a balloon, so I know what it feels like. The fantastic part for me, apart from losing 10 kilos, was that I learned how to run. And I'd gone from being a bit of a couch potato and not being able to run around a soccer field to, within a short period of time, in fact it was only 4 months, that I could then run 5 kilometres without stopping. You know, I'm no spring chicken, and it's certainly been a great thing, and I can still run, and I still do twice a week. So it's a real benefit. It has been a real benefit for me personally. Any questions about the balloon? Because it's reasonably self-explanatory, but any questions at the moment?
Does it limit your food intake? Like if you're people like me and you just eat, you can't do that with the balloon?
Not really, no. And the reason is that if you do happen to have a slightly bigger portion than what you really, you know, keeping an eye on your portions, oh, well, I've just enjoyed that so much. And yes, you go back to old habits. And then you just feel, I cannot eat another thing. It really makes you feel very, very full. And you just don't want to eat anymore. Interesting. Yes.
Is there a level of nausea attached to that? Or at some stage throughout the 6 months, or I guess at the beginning, would it be? Or
Yes. Yes, you're correct. At the beginning, because it's just been inserted and your stomach is thinking, what on earth is this thing inside me? There is some nausea associated with it. Most people, including myself, a day or two, and you don't have any more nausea. We do put you on medication to help you with that nausea, and the main thing is to try and keep your fluids up as well, so that you're not becoming dehydrated, and the nausea can be prolonged if it's dehydrated. If you're dehydrated, I mean.
So when it's initially inserted,
Yes.
inflated, I should say, what's the feeling? Do you have like a full feeling a lot of the time, or can you explain a little bit more how it feels?
Sure. It's a bit difficult to actually explain how it feels, but you just know that something's there. So you don't feel like, like when I started running, for example, I didn't feel like it was sloshing up and down or anything like that. The only thing that I found was difficult for me was laying on my stomach. You know, that actually I could feel the balloon. You can feel it, you can manipulate it around a little bit.
Does it bulge at all?
No.
And if someone was to, like the child was to land on you, or I mean, are you making sure you're careful around that area at all times, or?
Probably yes, to a degree, but that's only just a natural guarding, I think. My grandson was born basically about 2 weeks after I had the balloon put in, and I was able to carry him, and in fact I became more active with him. You know, he's only just 8 months old now, so you know, I was certainly able to be much more active with him, and I didn't find that it stopped me from doing anything. Yeah.
Thank you.
You know, later on, do you have another question?
Yeah, if after 6 months you've only lost, if someone wants to lose 30 kilos but don't want to do the surgery one, or want to do this, can they get it again?
Yes, you can. You can.
Can you get one taken out and one put in?
That would be after discussion with the surgeon as to whether or not he'd want you to have a little bit of a break, and it may just depend on when he goes to remove the balloon, what your stomach situation looks like. So they want to make sure that your stomach is not showing any signs of inflammation or anything like that. But yes, it can be. Yeah, we've seen that done before. Yeah. That be okay for now? We'll move on to the next procedure, and then we're all going to be around afterwards as well. So you know, please interact with us and ask questions if you'd like to afterwards, by all means. Okay. All right. We'll move on to the next one, which is the gastric band, and I think behind here. Actually, don't have the band, but so the gastric band has been around for probably 20 years now. It's a great procedure and it has been around for a long time because it has worked very well. And years ago, it was the only procedure we had to offer. So the gastric band is put into your and around your stomach via a general anaesthetic, so that there are 5 small incisions in your abdomen. The band is placed around the top part of your stomach, and as you can see here, it sits around so that it makes an indent in your stomach, and it ends up like that, so that you've got a small tunnel just on the inside here, and the band sits around the top part here. So what happens is when you start to have your food, you've got a small pouch here where your food sits, and then it slowly digests into the bottom part of your stomach. A bit like an hourglass, you know how the sand goes through the hourglass and it slowly digests into the bottom part of the stomach. The difference with the band is that there is a port here, the tubing that goes to the band, and that makes this band adjustable. So whilst it's adjustable, what that means is that every so often, every time you need, feeling maybe a little bit hungry, every time your weight might start to plateau and you might find that you're eating a little bit more, you can have a small adjustment, which is done here in the rooms, and that will make this little part here a little bit narrower, and then your food stays in the top part of your stomach a little bit longer, keeping you satisfied for a little bit longer. Hospital stays only overnight. Recovery time is usually about a week and a half. It's a great procedure. We've seen people lose anywhere from 20 plus kilos to, thank you, Warren. This is a little bit better. From 20 plus kilos to 139 is the lady that we've actually had lose that amount of weight. Now, that's not all people, but it's certainly a great procedure. It is reversible. It's not put in with the intention of removing it, but it is reversible. Sorry for the noise. But that's the way the band looks. I'll pass this around so that you can see. And the part that is inflated when you have a band adjustment is the little part on the inside. Okay, so I'll pass it around so that you can actually see what it feels like. It's quite soft and pliable. As I said, it's only a night stay in hospital, but you do have to have a general anaesthetic with this procedure. It's done by keyhole surgery, which means that you recover much more quickly. It's adjustable, it's reversible. The biggest complications that can happen with the band are probably more long-term rather than short-term. The long-term complications, there's 2 main ones. One of them can be band slippage, which means that the band just slips out of position. Why that happens could be you might have, I don't know, had a bit of vomiting or something like that. It could just be something that happens. They haven't got any real reasons why it happens. But if that happens, then you can have that replaced. It does need to be looked at, though it's not something that can be left. The second thing that can happen is what's called a band erosion, which means that the band can erode onto the inside of the stomach. When I'm talking about these complications, please be aware that they are on a smaller scale of percentages. So there's probably about a 1% of erosion and probably about 2% of a slippage. With an erosion, the band needs to be removed, but it can't be replaced. It needs to be taken out, just because it's been, you know, it's gone through the stomach. But as I said, it's a very low complication rate. And a lot of people like it because it puts them in control. You know, they can have a little bit of fluid out, put a little bit of fluid in. They're a little bit more in control of their actual eating pattern. It does mean that you need to keep in contact with us. We love it that you keep in contact with us, and that's what that's what to us shows great progress. And our own research has actually shown that the more people keep in contact with us and the more follow-up that we've had better results. And that's been research that I personally have been involved in and have, you know, it's been on our patients. So we certainly know that that's a definite, that the more you keep in contact and the more you have your follow-ups, then certainly you get a better result in the long run. Any questions about the band?
Where's the cord line? Inside or outside?
On the inside, not inside your stomach, but inside your abdomen. And the port is usually just in the upper part of your abdomen, about here, so that it can be felt, but it's not protruding. Okay, and they cut the cord. This is a diagrammatic, even though it's very close to what it actually looks like. It's still diagrammatic, and the cord wouldn't probably be that long, so it's sitting in there and it doesn't sort of entangle around your organs or anything like that. It just sits in your abdomen, and the port's placed in a part of what they call the fascia, so that, as I said, it can be felt. So a needle can be put in, but it's not outside. Okay. All right. Well, we'll move on to the next one then. Can everybody see that? Okay. This is the sleeve gastrectomy. This is called. Now, the sleeve gastrectomy has been around for a lesser time than what the band has been around, whilst part of the stomach partial gastrectomy has been around for a long time. Using it for a weight loss procedure is relatively new if you're comparing band to sleeve. How the sleeve actually started was people were doing, in America specifically, were doing bypass surgery for patients, and they found that they could perhaps do it as a two-part operation and take part of the stomach away before they did all the rest of the in-depth surgery, and then they could come back, they could lose some weight, and then come back to make their operation a lot safer. What they found was that having this procedure, whilst it was the first part of a procedure, actually they were losing such great amounts of weight that they then decided that they would trial it as a primary procedure, and that's how the sleeve came about. So it's now a great, a fabulous operation, and it's an operation as a primary procedure, so it's a first choice procedure for those who meet the criteria and following discussion with the surgeon decide that this is the one for them. With the sleeve, what happens is it's still by keyhole surgery, it's still 5 small incisions into your abdomen, but the stomach is actually cut away. So there's about 2/3 of the stomach that is removed, as you can see there. It's sealed with these amazing instruments that staple and seal and cut all at the same time, and that's on both sides. So you have the part that's going to be removed and the other part, both sealed. And then you're left with this small sleeve-like looking stomach. Now, it still means that there's only a certain amount of food that you can eat, and that's how the weight comes off. It's not adjustable and it's not reversible, but it's certainly something that will get the weight off. It happens more quickly than maybe what a band does. However, in the long run, when you're looking at the long-term benefits of a band and sleeve, at the end of 2 years, they're probably on a par. Okay, so the sleeve would help you lose weight more quickly. And sometimes, we've got people who live in quite remote areas that would come to us and have a sleeve because they don't have the access to the follow-up from where they live, and the sleeve works as a better option for them. For diabetes and high blood pressure, I wouldn't want to say cured, but it's certainly their symptoms are reduced dramatically very quickly. So they're feeling better much more quickly. This operation, you need to stay in hospital for 2 nights. And the risks with this operation, the 2 main ones are bleeding and leakage. Again, they are at 1%, so it's a really small amount, but doctor would explain all of that to you in any case when he talks to you about the procedure. You don't need as much follow-up with the sleeve as far as you would with a band, like the band adjustments and that sort of thing. And by removing that 2/3 of the stomach, it takes away a lot, probably a majority of the production of ghrelin, which is that hunger hormone that you probably have all heard perhaps about that hunger hormone, so that you don't feel hungry, but you still need to eat. And we will be having got 2 fabulous people here to be able to talk about their history, their story of what it's like to have a sleeve as well.
What's the difference between a sleeve and a bypass?
With the bypass, they'd not only take away part of the stomach, but then they would cut it actually a lot smaller they also then bypass part of the small bowel and then bring that up and connect it. So it's bypassing a part of the small bowel as well. So a little bit more involved.
Yeah.
Yeah, but certainly that's a procedure that we offer
What do you
also.
mean, what, 4 weeks is?
Yeah, so basically they're a lot of the primary procedures that we offer. We do offer bypass here as well, and that can be, for different reasons, but most people will go for something like the band or the sleeve or the Orbira as their first option. Any questions about any of that at the moment? No? Okay, as I said, we're all going to be around a little bit later, and I'll leave you to everybody else to explain their role. Thank you.
Very thorough and clear and easy to understand explanation. Thank you so much, Carol. Probably one of the themes that you'll hear throughout when you listen to our team is that team connection is one of the things that we stress the most. And we do that for a multitude of reasons. And the most important thing that we know that you're going to get the best long-term outcome from your surgery and the benefits of the surgery combined with working with a team. It's one thing to give you a great technical practitioner, surgeon or gastrointestinal physician in the case sometimes with insertion of the non-surgical devices. That's fantastic, but it's a very important part of the equation. But the bigger picture is dealing with all the different issues that have, I guess, compounded to get you to where you are now. And dealing with those long term is really important because not only do we want you to actually achieve an amazing weight loss outcome, but we want to make sure that you're having the best possible opportunity to be as healthy as possible. And that means addressing so many different things in your life, from a dietary perspective, from a psychological perspective, and that's where, here at Weight Loss Solutions Australia specifically, this is what we want to give you is a great team to work with. So when you do make that decision that you're going to go ahead with whatever the right procedure is for you, choose to commit to working with the team because I can promise you'll get great results from working with them. So I'd now like to introduce you to our psychologist team member, Warren, to give you a bit of an insight into his role and what to expect when you come in to see him. Please make him welcome.
Thanks everybody for coming. I'm the psychologist here at the clinic, and everybody who goes through bariatric surgery comes and spends a bit of time with me. And just to give you a brief update on basically what happens in this process is you will typically spend around 45 minutes to an hour with me prior to surgery. And in that consultation, the real key to the real key to that consultation is finding out as much as I possibly can about you and your background and some of the difficulties you've had with your weight and your weight loss attempts, and a little bit of history with regard to your eating habits and patterns and family dynamics. It's key to also find out a little bit about family relationships and past history with relationships and family background. All those things that are relevant to me in terms of finding out as much as I possibly can about you and your background. And there's a real good reason for this because Karen and I make up the Allied Health Support team here. And the time that you get to spend with us post-operatively is really important, in terms of strategizing about how we can get the best possible results and help you get the best possible results from your chosen procedure, whether it's a band, whether a balloon or a gastric sleeve. So one of the things that we do really pride ourselves on is being able to offer patients unlimited access to us in the first 12 months after surgery. So typically what happens is we'll schedule 5 visits for you after surgery. So first one's around 6 weeks after surgery, 1 at 3 months, 1 at 6 months, 1 at 9 months, and 1 at 12 months. Now those are just your scheduled visits, but if you feel like you need any extra support in between those, then you have access and unlimited access to both myself and Taryn. One of the reasons we do this is because in those first 12 months, it's generally also the time that you're going to have probably the highest elevation in your motivation with regard to changes that you want to make to your lifestyle. So we want to take advantage of that. And the reason being that you're losing a lot of weight. Most people are quite successful with these procedures, whether it's a band, a sleeve, or a balloon. So we want to tap into that motivation and see how else we can help you. And try and help you shift your focus from the outcome of your weight loss program to the actual process of your weight loss program. So all the little behaviors and all the little things that happen in between, what are the things we want to change, and how are we going to strategize, and how are we going to change those? And what sort of time frame. So in other words, we kind of set ourselves little mini goals along the way, so that we can assess the behaviors that are important to change on your journey. And 12 months is a pretty long time, so it's also an opportunity for lots of things to change and happen in your life. So we want to put ourselves in a situation that if you are experiencing challenges or changes within your day-to-day life, with your work-life balance, relationships, anything like that, then we want to be in a position to help you through that so that we can keep you focused on your long-term weight loss goals, if that makes any sense. Okay, so with that being said, those post-operative consultations are generally around half an hour, 45 minutes, and typically what happens is that they tend to coincide with important stages as well. So particularly the one at 6 weeks, the one at 6 months, and the one at 12 months. So for example, at 6 weeks, we actually run a group session. So it's here in our rooms, and I would encourage you, it's one thing that I always forget to tell patients when they come in here, is it's nice to be able to get a feel for the clinic and people that you are going to be liaising with and consulting with. So at the end of tonight, if you get a chance, feel free to have a look around the clinic and look at some of the rooms, and dietitian's room and my room. You'll see that we've got a number of services here to assist patients en route to their weight loss goals. So that 6-week post-op session is generally run by both myself and Taryn in her room, and will typically be 5 or 6 patients who've all had a procedure around the same time. So they're all typically around that week 5, 6, 7 after surgery. And it gives us a good opportunity to share the whole surgical experience and what your journey has been like up until that point. So the nice thing about it is you are in a room with like-minded people, so there's a lot of shared empathy there, there's a lot of understanding as to what you did as far as your procedure, what your chosen procedure was, what your goals are, what your challenges were. So it's nice to be able to be in a situation where you've got like-minded people who understand exactly what you're going through. It's also a good time for Taryn and I to introduce a couple of things. And one of them is talk a little bit about your diet at that stage, and then I talk a little bit about motivation for exercise and where we need to start at that 6-week mark. So generally we don't put you under too much pressure in those first 6 weeks, and we certainly don't burden you with too much responsibility, because we really want you focused on the post-operative stage, those first 6 weeks, because that kind of generally speaking, the most difficult is those first sort of 2 to 6 weeks after surgery. So just going back to the initial consultation prior to surgery, what I really want patients to do is come in and be as open and honest as they possibly can about all your challenges and all your behavioural traits and all the things that you find really, really difficult with regard to your weight or your eating habits. We get a combination of challenges coming from patients, so whether it's emotional eating or whether you have a history of depression or anxiety or anything like that, any abuse, anything like that. I know it can be sometimes quite difficult to bring, but that's probably the best time for you to try and raise any issues like that, so that I can at least strategize a little bit about how I can help you, what the best way to help you post-operatively. And that pretty much covers it as far as my role goes. Any questions for me? No? Yes?
I do have one. If you have a patient coming to see you and you evaluated that patient, do you make the decision that they may not be suitable? Is that something you look at?
Yeah, sometimes. To be honest, yes, it does sometimes happen. Thankfully, it doesn't happen a lot at all. So, I mean, I can't tell you how often it happens. You know, I would certainly say probably 1 in every 3 or 400 patients might not be suitable for surgery, and it comes a lot of times it comes down to timing. So perhaps the timing's not right for the patient, in the sense is that perhaps there's too many life challenges going on at that particular time, or the work-life balance is perhaps not right, or perhaps there's a lack of family or friend or emotional support. It is important to have support on both sides. I mean, we give you the clinical support, but it is important that you've got other people around you who support you through this process. Other than that, and as I say, that's something that very rarely happens. The only other thing that may happen is if somebody's got an extreme, pervasive psychological disorder that makes it difficult for them to follow through with medical advice, dietary advice, and behavioural advice, then obviously that poses a few challenges as well. However, in saying that, we even have patients who have very, very difficult psychological disorders, including things like schizophrenia, and we don't turn them away. We find a way to help those patients as well. So if I feel that I'm not equipped to provide that support for that particular patient, then we'll certainly go out of the way to help us find you somebody who can perhaps support the patient through those particular disorders. So, generally speaking, the most common are depression, anxiety, obviously some eating disorders, history of abuse. Generally speaking, those are the most prevalent issues.
And you obviously can really help that.
Yeah.
Obviously with the surgery, but you find it's very successful having this side of things as well, speaking to a psychologist all the time. And
yeah, well, look, I mean, it's one of the things that is widely advocated around the world these days, that clinics should really have allied health support. That includes a dietitian and a psychologist. And I think, as I said before, a lot of it comes down to the length of a weight loss program, and then because so much, generally speaking, the weight does come off quite quickly, but your overall journey, is probably at least 12 to 24 months. So you've got to, I suppose, the way I look at it is it's nice to be able to have a clinic that has people there who can support you through the ups and downs of your journey, the ups and downs of your general life, and to make sure that you remain focused. To be honest, it wouldn't be any different if you were all sitting here all telling me you wanted to win Wimbledon. You're all tennis players and you want to go on to win Wimbledon. Well, if that's your goal, we've also got to break that down into smaller, more achievable goals as well. And that journey in trying to win Wimbledon could take you a long time as well. So there's a lot that's going to happen in between that, and we need to work through those issues as well. So I do a little bit of sports psychology, so I borrow a lot from sports psychology with weight loss surgery as well.
Thank you. So if winning Wimbledon is one of your goals, you've come to the right place. And if you're thinking if you'd like to have a tour of the facility at the close of formalities tonight, Warren he'll meet you over there and where he is in the doorway and take you on a tour of the clinic. Thank you very much, Warren. That was fantastic. Great to hear. And I think really the key message is having a psychologist who can support you whenever you have that need, and each individual's journey is going to be different. You don't know in advance of having surgery what barriers you might encounter at 6 weeks, at 3 months, or whenever it might be. But the important thing is that we provide the solution to manage and make sure that you've got support no matter what. We also love getting involved in all sorts of other aspects of your growth long term once you actually are on that journey to achieving weight loss. And Carol mentioned earlier that she's learnt to run, and it's absolutely been such a pleasure for all of us to actually share that with her as part of her weight loss goals, with having had the Orbera intragastric balloon, that running was a goal for her. And we love seeing people getting physically active, and that's why we actually launched our own we actually support and sponsor a running program, so that if that's something that you're interested in getting involved with, and you've had this lifelong ambition but you've actually never done it, that you can actually join that as a beginner. And I think when Carol first started, she mentioned she couldn't run across the sports oval, and to get from that to actually be able to run 5 kilometres non-stop, I think is just a fantastic achievement. So anyone can do that, and the opportunity is there for you. We also have staff who are absolutely fantastic at using their very many and multiple skills within the practice. And Michelle is not only a receptionist here, but she's also a very talented chef. And so with Taryn, they have actually started working on some cooking programs. So if you're interested in education and you want to learn better cooking techniques and how you can actually maybe change your whole healthy eating approach to life, then you can access the support of additional programs long term as well. So if you think that's a benefit to you, then we're always looking at developing new aspects of our program, and I think they're great for anybody. Their cooking classes are awesome. So yeah, that's the opportunity that you have as a patient of this clinic. I'd now like to introduce you to Taryn to address all of the issues in relation to food and all of the procedures that we offer you. Thank you.
Thank you. So hello everyone, thanks for coming along tonight. Yeah, I'll just spend a little bit of time running through and giving you a little bit more information about the different procedures and how they're actually going to impact your food intake. So my role here is really, I'm sort of the 12-month package that we offer. You can come and see me as many times as you like. For some, we sort of have like a suggested program, and people will take advantage of that to different extents. So, we have some people that come back every month or every fortnight for a period of time, and some people that come back less. But it's available to you, and yeah, it's great to take advantage of that to really try and make sure you're getting off on the right track with this. So the first step is that I will see everybody before you have surgery, or not surgery if it's the or beer or balloon, and that's just a chance to really sit down and have a good look at your background and your eating patterns and your lifestyle, just to try and help you get a good feel for how things are going to change afterwards. So certainly the procedures can have a pretty big impact just on your, every time you eat, it's a bit different, and that can take a bit of getting used to. So it really makes that transition easier going into it really well informed. So now with both the, I guess I sort of think of it as being the sort of two parts to this from a dietary point of view. So we have the early stage, which involves a pre-surgery diet, and then a transition back to normal textured food. So you start out just on liquids for a couple of weeks, and then you're going on to puree food. So just gradually as the stomach's healing, getting back to normal food. So we've got some sort of pretty clear guidelines about what you need to do at that stage, and that's really about getting you safely through the healing process. We're not really thinking much about weight loss at that time, although it does happen, but it's more important at that stage that you're getting everything you need, you're keeping hydrated, and you're getting enough protein to get you through that stage. And then we've got more the long-term side of things. So once you've started to get a feel for how it all works, there's certainly things that can pop up and changes that most people find they need to make to get a really good outcome with it. So so the first step of that is a pre-surgery diet, which is like a very low calorie diet, which we generally use meal replacement type shakes before. You've had some experience with that, have you?
4 weeks out of sleep.
Oh, okay. Oh yeah, okay. I'm looking out and didn't sort of look that closely. See, this is what happens here. We see people even within 4 weeks, and they change. It's amazing actually to really see that transition in people, or transformation. Now, just to sort of touch a little bit on the different procedures, so and sort of how they impact your food intake. There's slight differences, sort of between the band and the sleeve. But they both, and same with the Orbea, are sort of all basically reducing the amount that you can eat at one time through various different means. So with the band, you've sort of got that band that's sitting around the top part of the stomach. So one of the really important things with that is that you actually eat a lot more slowly. Okay, so we sort of really need to go through the process of retraining, smaller mouthfuls and stopping in between each mouthful. So eating is something we tend to do really automatically. So there's this kind of retraining process to go through. Now, with both of the procedures, it is important to eat, to really look at your eating patterns. So if you're maybe someone that tends to, skip lunch and go for hours and hours without eating, that's something that doesn't sort of work too well with both.
With my job, sometimes I don't get a chance to eat that way because they can get a break sometimes.
Yeah, and that can make it really hard, so that's what we. Yeah.
I'm normally at work now.
Okay.
Yeah.
And that's the sort of thing that we really need to have a good talk about beforehand and sort of in the early stages to try and get some things in place. So, with the sleeve, for example, if you go for a long time without eating, a lot of people do find that they actually start to feel a little bit sick, and it doesn't take much. It might be just a few mouthfuls of food that suddenly you have that, it might be half a banana, for example, and you're completely fine. But if you go for a long time, you can really sort of start to feel it.
I work permanent nights. I usually have to eat about 2, 3, and then I won't have enough. Sometimes it's only 5 in the morning before I get something to eat again.
Yeah, and we see that a lot. We do see this sort of, whether it's shift work or just general sort of busy lifestyle patterns that we've got into that can really sort of make that a little bit challenging. So, yeah, with the sleeve, it's you can sort of see there how the stomach capacity is changing. So the amount that you're able to eat once you've gone through that sort of healing process is generally it's about 1 cup of food per meal, and that'll vary from person to person, and it will sort of change as time goes on. But that's sort of a bit of a ballpark amount. Now, if you don't eat all day and then you're just depending on 1 meal, you're certainly going to not be able to get everything that you need. So yeah, so really we just try and focus on this concept of eating small regular meals. We need to try and really focus on the more nutrient dense foods. So we've got to pack a lot of things in that small amount of food. So it becomes really important the food choices. Now, both of the procedures can have an impact on your appetite. So most people will find that they just don't feel as hungry, or they may get hungry, but it's a very easily satisfied appetite. So, you tend to sort of feel, it's like early satiety. So you'll have a small amount of food and you're quite satisfied with that. And, that's one of the things that tends to make the whole process a lot easier for people, because it's often a common concern before surgery. People sort of think, am I going to still want more, but I can't eat more? And it's actually usually not the case. So most people will say that they have that small amount of food and they're actually feeling quite satisfied with that. So, now there's a few things like eating and drinking at the same time, which is really, with the sleeve, it's, most people find that they can't really do that at all, aside from maybe a few little sips of fluid. It's just not enough room in there, so if you sit down to have a meal and you have a few mouthfuls of food and then you have a big glug of water, then you'll be feeling really uncomfortable. And it can be a really sort of sudden, just that 1 mouthful that you've had a little bit too much, and suddenly you're like, it's really, sort of strong discomfort. With the band, there seems to be a real mix. So some people do find that they can have a drink with food quite comfortably, and others don't. So that's something that you need to work through as well. So now, so if you're sort of picturing how little that you can eat, as I mentioned before, it's important to make sure you're getting a good balance between all your different food groups. We do also sort of routinely recommend a multivitamin supplement, and we keep an eye on your bloods as well, just to make sure that you're not actually, becoming deficient in anything over time. So that's a multivitamin for the band, and also a B12 supplement for the sleeve, and it may vary from person to person, just depending on the outcome of your blood test. So, so that's a little bit of an overview. Is there any questions?
You speak about the band and the sleeve. Does it is it relevant to the balloon as well, or is that totally different?
Sorry, I have focused a little bit more on the surgical procedures. So and that's probably because with the sleeve, it's sort of like a smaller version in the start. So there's not really a pre-surgery diet as such, and then that transition back to normal foods is much shorter. So usually 1 or 2 weeks before you're back to normal foods. But really, the way it impacts the amount is actually really similar. The types of food, which for most people, we are working towards being able to eat a really good variety of food. So it actually has. All 3 procedures end up having quite a similar impact on what and
So you
how
mentioned
you
a
eat.
cup
So
per meal. Is that the same with the balloon?
it's similar, yeah, similar. Again, it will vary a little bit from person to person. So, but yeah, it is a similar sort of volume. Maybe with the sleeve, for example, it has its strongest effect early. So in the early months afterwards, that's the time when it's the most restrictive, and then it will start to ease a little bit with time. But if you're looking at someone 12 months, 2 years or so after a sleeve, it would be quite a similar amount to someone with a balloon. Yeah, but it might be a little bit less early on. So, yeah. Anything else?
Question, sugars. Biggest culprit of all with most people with weight gain is the amount of sugars we can consume. How does the sleeve work if you've got like a sugar, you're a sugar addict? Does it do anything? I mean, can you okay, so, like I could sit down and eat an entire block of chocolate or a whole heap of chips in one go.
Yeah.
Had the band, it does slow that down.
Yes.
With the sleeve, is it similar?
Sleeve,
I can't see getting a whole
That's
packet
right.
of chips without throwing them up, or a whole
Certainly.
packet of biscuits.
Yeah, exactly.
So does it work?
Whereas with the band, you
slow?
can sort of slowly over time manage to get through a larger volume of those type of foods. And certainly what I see in practice is that people that do have those behaviours, that the sleeve is really quite powerful in. One of the interesting things is a lot of people find their sense of taste is quite heightened. So it's really common for someone that really love chocolate and sit down and eat heaps of it before to just find that actually tastes a lot sweeter afterwards. So they're more satisfied. They can sit down and enjoy a small amount, but then just take it or leave it. And other people find there's things that they really loved before, but they just can't even. It's just that they don't even think about it anymore. So it does. Some of those hormones and sort of chemical messages that are communicating with your brain from your stomach, it changes. So there can be some real changes there. So yeah, and you are less able to eat a large volume of those type of foods.
Don't you find, Taryn, though, that a lot of people report less desire for sugary type foods as well after a sleeve because of that they're less prone to want to eat sweet foods?
Yeah,
Is that true?
That can certainly happen. And it's mixed though, so you'll get some people that say they actually don't feel like it at all, and others who say, if it's there, they'll still have a little bit and enjoy it. But really, the vast majority of people do. If they are eating it, it's going to be a lot smaller amount, and that's actually not a really difficult thing for them to do.
Subject, but how does it affect
You can demonstrate.
So obviously if you're eating, I've got there's 4 people at my work that have sleep.
Oh yeah.
And they still eat the crap food, but they can't eat the amount that they were eating before.
Yeah.
The biggest impact they told me was their bowel motion.
Yeah.
And what happened. So I'm probably looking at the Albera. How does that affect the bowel motion?
With the Albera? Again, it's because the total volume of your food is smaller, and often the foods that are good for our bowels are your more bulky, sort of fibrous foods and that sort of thing. So that's where it is, as I was saying before, having little meals often and really making sure that you are getting your veggies and your fruit and your high fibre food. So every time you're sort of going for something, trying to go for the more nutrient dense option. So yeah, it's something that we do need to manage, and we sort of address it a lot in the clinic. It's certainly not impossible to have good bowel movements, but if you do, like maybe some people that you're mentioning maybe still don't eat really good foods and just eat less of a small amount of bad foods, then it can be an issue, but it doesn't have to be. Yeah, there's certainly ways of modifying the diet and using supplements, fibre supplements and things early on in the piece when we need to. Yeah. Question or a scratch?
Maybe wait till after, maybe. Is everyone happy to have a chat with Taryn afterwards? And
Yeah.
okay, cool. Thank you so much. Really important to take on board the advice of the dietitian and work with her as well right throughout the program. In the bags that you've got tonight, there's a couple of magazines in there. Slim Magazine is a magazine that our team contributes significantly to, and you'll find there's some really great stories in there about people who've had all of the procedures here. So take your time to go through that and read that when you do have a moment. I can see that people are getting tired. We won't keep you going. We won't keep you here for too much longer. Is everyone okay and ready to listen to our patient stories now? Because we've got two awesome people to introduce you to. Most important part of the evening, I guess, and from where you're coming from, is to hear what it's like from a patient experience perspective and what have they been through. Bless you. I will also mention to you that apart from being around to chat to you at the close of our presentations tonight, if you are really keen to take the next step forward, I would really encourage you to come in and have a chat with one of the team, possibly with the surgeon. You can have we bulk bill your first consultation so that you have that access to an appointment where you can just talk about and assess your own personal situation and start thinking about what you'd like to do. So if you wanted to do that tonight.
Who is the surgeon?
Dr. Adib is our principal surgeon. Yeah. He's a surgeon I've known since 1998, and I've watched him on his career pathway since he was a surgical fellow. In 98, he was actually at the Royal Brisbane Hospital at the Wesley. So I've had the opportunity of working with him over many, many years, and have absolute confidence in his surgical skill set, but we also have some other team members as well. So I guess it's most important to have best surgeon for best procedure and for each patient as well. So yeah, he's awesome, and he has not only amazing technical skill, but he's also is lovely to work with.
Does he do all three?
He absolutely does, yes, absolutely everything. Yeah, there's nothing that he doesn't do. And also, given the fact that we have a significant history and a lot of patients to look after who we're committed to looking after for the long term, with the length of history that we've got and the number of patients that we manage long term, it's really important that the surgical skill set can manage whatever complication comes their way. And because we've started so many years ago, we've got thousands of patients who've had gastric bands. And 14 years down the track, you're going to come across those who, for whatever reason, don't live well with a band, and they may need to have a conversion to an alternative procedure. So that's just the nature and the evolution of bariatric surgery. And so for us, having a bariatric surgeon who can look after those issues, and no matter what complication might come their way, is really key for us when we're delivering a procedure to any patient. So yeah, have absolutely every confidence in delivering, great high skill technical ability to any patient here. Right, who's next? This is the best part. So I'd like to introduce you to Melanie to talk to you about her own personal experience of having had bariatric surgery. So we like to actually try and have a female and male patient at every seminar. So we're really, really lucky that we have some incredibly generous people who love to come along and share their stories. But we're going to start with Melanie tonight, and just also be aware that she's here at any time. You can call and chat to Melanie about whatever you need to, because she's here most of the time. Please make her welcome.
I'll quickly answer a question I think you took. Someone was talking about being a sugar addict, was it? Yeah, that was me too. I was one of these people. I used to sort of laugh when I looked on the back of packets and they had calories per serving and calories per packet. I went, who doesn't eat the whole packet? What do you need that for? I just couldn't understand why there was calories per serve on the chips. I'm like, who doesn't eat the whole packet? Or calories per serve on the back of the Tim Tams. I'm like, isn't the whole packet the serve? And to me it was. So this is my sort of treat now, these little chocolates. I'll pull them out for everyone so you can see the size. I normally have 2 or 3 of those after lunch. That's it.
And you're satisfied.
Love them. Yep, that's it. So that's it. And it really does. It's just the feeling of satisfaction is very different once you've had the surgery. So I'll go into a little bit more. That's me about 3 years ago at 120 kilos. And when I came to the clinic, I came exactly like you did to a seminar night. My auntie was coming to a seminar and she very kindly asked me to accompany her. But she didn't get lost, which I think was a well-mannered way of saying that you could do with this too, but she wasn't sure how I'd react. So off we did. We came. I was like, oh no, isn't that only for, those really big people who are locked in their house that have to be saved by Dr. Phil, or it's only for really rich people? And I'd oh, I've seen a story on a current affair about some woman who'd had that. So I'd heard all the horror stories, but wasn't actually really educated on what weight loss surgery was and who it was for. I came to a seminar and I could not sign up quick enough. I was so excited afterwards. I actually started with the band. At the time, my husband had his business. I had my own business, 2 kids, very busy. So I thought, well, the band's the way for me to go. I was a real control freak as well. So I thought, okay, if I have the band, I can say how tight, I can say how loose. I can have it tightened when I want, loosened when I want. That's the one for me. So I decided on the band. I had the band for about 2 years. Yeah, about 2 years. And I got a horrible vomiting bug that just had me throwing up all the time and ended up with a slippage.
Someone else had the band as well.
Yeah, so that's how I ended up. When they talk about a slip, unfortunately, that's what I got. And at that time, I also wasn't prepared to commit when I had the band, I'll be honest. I thought, no, I might decide that I prefer food and I prefer to be big and I don't know if I'm ready to commit to this forever. And I thought I'd done every single diet like you. I'd done all carbs, all protein, no protein, processed meals, shakes, the pineapple diet, the avocado diet. So like everyone, and I'd lost a bit of weight on all of them, but it came back. So I thought, well, this might be the same. I didn't know, so I just wasn't prepared to commit to and at that stage of the sleeve, I was like, no way, I'm just getting my head around this one. So that's why I started with the band. Then when the band slipped, I realised that I was healthy and I was losing weight and I could survive on small portions of food. So that's when I went, oh no, just give me a sleeve, I want this forever. Another thing I think I found that I just don't have that portion of my brain like some people do, and I really admire people who have that self-control and say, no, that's enough, and stop. I just do not feel that I was programmed that way. I didn't know when to stop until I felt sick. When I would feel sick, I'm like, okay, I'm full. To me, a sick feeling was a full feeling. And I also never felt satisfied. I said there has to be another layer to that food pyramid because I could never find the thing I wanted. I'd have dinner and I'd be thinking, okay, it's going to be something sweet. Then I'd have some chocolate. Something crunchy, I must want some chips. So then I'd have some chips. I don't think it's chips. I think I need something creamy. I think I'll have some ice cream. Then I'd have ice cream. Now, salt, peanuts. Then I'd be into the peanut. There was just never anything. I was always standing like this at the fridge or the cupboard. Going, what now? Just, I'm sure a lot of you can relate to it. I know. I was always, there's got to be something else. And I think that's the big thing with this is, as I said to you, when I feel like a bit of chocolate, I have 3 of those.
I don't have a big piece of steak, chips, and something about an hour later I want something else.
Of course you do. And you don't really need anything. It's this. So that's why I needed a handbrake to help me. I say to people, I've just had a handbrake put in. I didn't have a handbrake in my car, so I've now had a handbrake put in. It pulls you up. It tells you stop. It makes you think. You also feel satisfied with what you have. You don't have the whole packet of Tim Tams and go, I think I needed chips. You're happy with 1 Tim Tam. If someone had said to me once, you can have 1 Tim Tam, I would have gone 1 Tim Tam, as in 1 packet. No such thing as 1 Tim Tam. But you really can.
One packet of chips.
Same, exactly, and it wasn't a packet of chips. To me, a family
big
packet.
packet of chips.
Exactly. Now, if I really feel like chips, I have chips, but I have the little snack packs that you give to kids. If I feel like a Tim Tam, I have 1. So that's the thing. You can still have whatever you want to have. You're just happy with a smaller portion.
So you've got the sleeve now?
I've now got a sleeve. I've had the sleeve for about 2 years. I've lost 50 kilos, all up. Sort of give
You
or
were
take.
successful with the sleeve to the band?
Yes. Now, talking about the handbrake thing, what I learned was, by this stage, I was out of my own business and I was working here. So I knew what to say and I knew what to do. I was working with people who were in that situation. And when I had my band out, I had to wait 8 weeks to have my sleeve. And in that time, I put on 9 kilos. I knew what to do. I would say, okay, I'll have a small portion of food. And I look down and go, oh, it's all gone. It was just gone so quickly. I just felt like someone had taken my handbrake away. And then I was at the, oh, well, that didn't fill me up. I must need her. And I thought, here we go. So it proved to me that no matter what I have done, I needed that assistance. I just can't do it on my own. You know, I've tried, as we said, all the diets before. So that really proved to me that I'd done the right thing. I think what I'll sort of talk about, I won't go into the whole big thing tonight. A lot of the questions I had when I came here, or things people had said to me when I as I was a beauty therapist when I came to have surgery, so I saw lots of people every
Flying
day.
again.
Oh, really? And I was so excited, and I've got a big mouth, so I was telling everyone, I've been waxing their legs, guess what, I'm having a lap band. They're like, what? So I had people starting to put negative thoughts in my head, and I think they'd all seen me diet so many times over the years. I'd come in to wax the legs, I'd have a shake, I'm on the shake diet, or I'd have a pineapple, now I'm on the pineapple diet. So they'd seen me do so many diets over the years, and I was like, I'm having a lap band, and they're like, here we go again. So I'd stopped telling people. I thought, I'm not going to tell you, because I was so positive about it and thought, I'm going to make this work. And I'd heard a bit more and I was a bit more educated about it. I thought, I'm just not going to tell people I'm so positive and I want to go in with a positive attitude. So I decided to keep it to myself for a while. And then as the weight started to drop off, I had a particular lady who only used to see her every few months. And I said, do you want me to book you in again? She sort of rubbed my shoulder and said, will you be here, dear? Yes. Why? Because you're just losing so much weight. I'm just wondering, are you not well? I went, oh, okay. And that's when I thought, it's time to fess up. People will stop making appointments. They think I'm dying. So I had to sort of tell people what I'd had done. And by that stage, people weren't going to be negative to you, probably behind my back. They can talk about me if they wanted to. But they could see it had worked and I was making it work for me. And that's when people were sort of a lot more positive and supportive. You'll always get your haters. There were the things that got to me was, isn't that the easy way out or the cheats way? That was my favourite one. Firstly, anyone who has done all the diets that we've all probably done will know there's nothing easy about diets. There is nothing easy about being overweight, and it gets to me about, I'm like, the cheats way. Why is it the cheats way? No matter what procedure you have done, all the procedures we offer, none of them buy your food, none of them cook your food, none of them serve it up, and none of them jump into your mouth. You've got to do all that yourself. So how is it cheating?
Wasn't
How
like
is it
now
easy?
with like steaks, because I love your red mate.
You can still have, as I said, you can have whatever you want, just a small portion. So you can still have whatever you want. Things that are off the menu, I'd say, are fizzy drinks. They just really fill you up pretty quickly. You couldn't eat and drink at the same time. That would be an
Is that
issue.
the same with the sleep, the fizzy drinks?
Yep.
It's like the bang.
It took me 6-7 months until I could have a fizzy drink. Of course, the first fizzy drink I had was champagne. But you can't have a fizzy drink.
I could down probably 300 or 400, 600 on Coke today.
Yeah, no, you won't be able to do that.
And I can do.
And if you do, you can't do food. It just fills you up and bubbles around in there so much. And you wouldn't do that to a new sort of tummy that you just had anyway. It's putting pressure on it. But you won't feel like it. So you will, everyone will test their boundaries. Everyone has a different amount of what they can and what they can't have. And you don't know, and you don't get to being overweight unless you do test the boundaries. And it's also mindful eating as well. My thing was I didn't think when I ate. I would just put it in, put it in, put it in. And one night after I'd had my procedure, I was dishing up. We had takeaway and everyone had Chinese, and I was dishing up and just picked up a bit of sweet and sour pork and threw it in my mouth. And that's how I used to eat my food. I pretty much inhale it, chew it 2 or 3 times and down it went. And I went, oh, that's not good. And of course it wasn't. Trip to the bathroom. But that's the thing. I used to eat mindlessly. I didn't even think. If anyone left anything on the plate, I was like a seagull and it was mine. So I wasn't one of those people that would say to my kids, eat everything on your plate. Because I'd see that cutlet there and I'd be going, oh, I'm eating that. So I didn't make them eat everything on their plate. So I treated myself like the bin. Instead of emptying the plates into the bin, they went straight into my bowl. So anything that was left, I ate it. But I didn't count that because it was off someone else's plate. Same with when I was making dinner. I look now at what my portion of dinner is, and it's pretty much what I used to taste while I was making dinner. So I was having a small meal before dinner. Even drinks, high-calorie drinks, at the time, I justified everything because I didn't eat all day. You probably know in that industry, you go hard all day, and I had kids, and I had to leave to get my kids at 3 o'clock. But then from 3 o'clock until my eyes shut, I didn't stop eating. And I justified because, I didn't eat all day. I didn't have breakfast. I didn't have lunch. And as soon as I'd leave the salon...
I have a job like that if you don't get time
No.
to eat.
No, so I'd go through the drive-through, and then you get a burger, but that doesn't count because you didn't have breakfast or lunch. And then I'd go to Zaraffa's because those silly buggers have a drive-through as well. And I used to buy the biggest drink they had. I used to have a white chocolate mocha. So it was that big. It was on full cream milk. It had cream on top with little chocolate sprinkles on top. It was made with syrup, and I like a sugar in my coffee. So because it was that big, I had to have 3.
Yeah.
So that I would have one of those, if not every day, every second day. but that didn't count because I had it in the car and I didn't have breakfast and I didn't have lunch. So again, I justified it, whereas now I have a soy milk cappuccino and I normally have an extra shot of water in it because I don't like it too creamy. So that's sort of how your taste
And
changes. I don't like
also
creamy
love
food.
me iced coffee as well.
And you probably won't like that much, or you won't want cream in it or ice cream in it.
I usually buy I don't think what brand it is now. I just go to the shop, buy it, crack.
And it's gone.
Yep.
Yeah, yeah, and that's it. You inhale your food. We don't enjoy our food. And another thing I love were hot chips as well. You know, hot and salty and crunchy. Whereas now I eat my food so much slower. So if you eat them slowly and you chew them a lot, they actually just taste like wet potato. The next time you have hot chips, stop, slow down, just have one and chew it for a long time. They're actually not as good as they taste when you're inhaling them. So when you do stop and eat things slower, you'll find that you just choose different food. I mean, I'm clearly a guts. You don't get to being 120 kilos if you're not. That has not changed. My mind hasn't changed. I still go for quantity over quality sometimes. So if I can have 8 hot chips or a big bowl of salad and fish, I'm going with salad and fish because I get more. So it's just what I can intake, and that's still something with my head. I'm like, yeah, I'm going to go that salad. That's huge. I'll take a salad. I'll very rarely eat it all. But you can only have so much of other foods. I don't eat fried food now pretty much at all. It doesn't agree with me. I don't like it. I can taste the oil. So I just choose not to go for fried foods at all. I'll occasionally steal a nugget off one of my kids, and I always regret it. They always smell so much better than they taste. So you have one and go, oh, yuck. So fried food's pretty much off for me. So I think that's the thing for me was I've just had a handbrake put in. I've had something put in to help me. So that was that whole the cheats way or the easy way out. It's not a magic wand. It's not going to give you a better job and make you win the lotto, make your kids behave. You still have to do everything yourself. So there's still a lot of work to do. And there's a lot of work with your head. Use Taryn and use Warren. I still, to this day, 2 years out since I've had my sleep, dish up normally too much on my plate. Because if I dish up what I actually eat, it just looks really stupid. And that's getting around my head. So I always put a bit too much on there and always leave something. Which is another thing to get around. Eat everything on your plate. That's what we were taught when we were kids. A lot of you probably were. Again, something I've never said to my kids. It's okay to leave food on your plate. You know, when you're out and someone comes, the waiter comes and says, was there anything wrong with your food? It was lovely, but I've had enough. It's okay to leave food. It's okay to say to people, I've had enough. So you've got to get that around your head as well. Yes, you can still go out. I thought, I'm going to be able to go out and eat again. I can just have soup forever. But you can go out and eat. Again, just be prepared to leave something on your plate or order an entree. An entree is normally pretty much the size you want. If you order a main, sometimes there's something I really want in the mains. I'll just be prepared to eat half of it or a third. Normally your partner and your friends get bigger as you get smaller because they get all your leftovers. As for alcohol, I'm surprised no one's asked that. Normally that's one of the questions that gets asked, so no one looks like an alcoholic. When you go out to eat or at home, you can definitely have an alcoholic drink, just not at the same time as dinner. So if you are going out to dinner, I normally have a wine straight away. By the time everyone's looked at their menu and got an entree, mains come out, it's normally a good half hour, so that's fine. Then I can have my meal. Half an hour, 45 minutes, an hour later, when everyone has dessert, I'd have another one if I wanted to. So you can still drink when you go out, just not at the same time. So it's not off limits. Going out, it's not off limits. Socialising, whether you tell people or don't tell people, that's up to you. You're not lying if you say, I'm just eating. People say, what have you done? You don't want to share? I'm eating less. Exactly what you're doing. So you're not telling any lies there. Don't feel bad about that. So if you choose not to tell people, you've got a support network here. We do have patients say, I don't want anyone to know. So they do lean on us a bit more. They chat on our Facebook page. They come and see Tara and Warren a bit more. They talk to us. There's some private Facebook groups, and no one can see sort of who is in there either. So you've still got people to talk to without telling everyone what you've had done. Most people start, they don't want to tell everyone, but after they've done well or they're doing good, then they do like to tell people. So we find most people who start off sort of quite secretly end up at a seminar telling everyone what they've done. So if you do choose not to tell anyone, there's lots of support here as well. Any questions? Anything that you've been thinking?
You said you lost 50 kilos. Did it take you the 2 years to do that?
Oh, because I had that little sort of muck up in the middle, I'd actually say it took a little bit longer. I'd say about 2.5 years to do that.
So was that better that your skin shrunk in with you instead of having to have surgery?
No, I didn't. No, I've had more surgery. We have a lovely plastic surgeon who works with us as well. So that's age. That has to do with age, the elasticity of your skin, whether you've had children or not. Everyone's different, and we've got patients. I'm in my 40s, so we've got patients in their 40s, and they've sort of lost the same amount or more than me, and they look fine. But I really had a lot of excess skin, so I did have.
Usually, roughly what age does your skin stops going back?
It's individual things, not an age thing. So it depends on the elasticity of your skin. And normally men sort of come in better than women. Women, once we stretch out, we tend to stay that way, unfortunately. So yeah, so it can be. But again, that was another choice. I had a patient recently. She said, "Oh no, I don't know if I want to do this. What about the skin?" I said, "Well, I thought that too, but in the end, I chose: do I want to be thinner and healthier with excess skin, or do I want to fill it with excess weight?" So it's definitely much easier to hide a bit of excess skin than it is to hide the weight. So don't let that one scare you off too much. That's it. Okay, well, Luke's going to talk to us next, and he also sat in these seats 12 months ago. So please enjoy. Thank you.
Thank you, Melanie. All right. It gives me great pleasure now to introduce Luke to you. I can't believe that it's only around about almost coming up for 12 months since he had his surgery, and to see that total transformation in such a short space of time, because really it is a short space of time. You could still be, where you were 12 months ago if you hadn't have come along to a seminar, and I just think your results are absolutely amazing. Luke started out at 147 kilos. He was wearing a size 7XL, and just fantastic to see him here tonight and have him here to share his story with you. Please make him welcome.
How you going? Yep, my name's Luke, and I did 11 months ago. I was 147 kgs, and this was me back then. I have weighed heavier. I was a lot heavier at one stage. Lost a bit of weight. I moved away, fell into a bit of trouble, came back, and I had to go on antidepressants. And I put it all back on. Within, I think it was about 4 months, I put nearly 40 kg on. It was just excessive. And my dad had this operation nearly 3 years ago now, and it was 2 years maybe before that. And I came here and I spoke to my dad, and my dad was just phenomenal. I was going to get him to come up with me tonight, but he couldn't come up. And it's just life-changing, really. I can't describe how happier I feel after having the sleeve. I had the sleeve, and I was diagnosed with diabetes in November 2012, and I had the operation in July 2013. So it wasn't 12 months, and I don't have diabetes anymore. From the day I had surgery, I never had my diabetic tablet at all, and don't regret 1 minute of it. Yeah, it is life changing. You've got to learn to eat all over again, basically, and your stomach teaches you to do that. It teaches you to slow down, to not eat so much crap that you usually eat. And I used to, as I said, with the soft drink, I was like nearly 8 to 10 litres of soft drink a day, and now I can barely drink a 600 ml. Not even that. I can barely drink a can of soft drink, and that would take me a day to drink that sort of a can.
I'd be down a can in like seconds.
Oh yeah. So could I. Not now. And it's the same thing with all junk food and all that sort of stuff. I was mad. I was horrible with it. It was but now it's just totally and utterly opposite. I used to be a savoury person. I loved my savoury, my pastries, my pies. I loved pie. It was my favourite thing ever. And now I don't like pies. I hardly ever touch a pie. And if I do, it's never the packet ones. It's always the ones you can buy from like a homemade sort of pie, one with a light sort of pastry with it. And
like a bakery sort of thing.
Yeah, not the really thick pastry ones. And still then I can't even eat the whole thing. It's always half of it, you know. And yeah, and it's just it is like the best thing. I haven't stopped smiling since it. Yeah.
So can I ask you how much weight you've lost?
46 kgs. Yeah.
That's over a 12-month period.
11. Yeah. 11. Yeah. I lost the majority of it within the first 6 months, and it slowed down dramatically after that. And I mean, I walk every day. I walk every day. I do roughly about with my work. I work in retail, so I walk constantly all day for 12 hours a day. So I walk about 9 k's a day just at work. Plus I do walking in the mornings and all that. So I wake up extra early just to do that sort of that extra. And you want to do it. Back when I was a lot bigger, you just couldn't be bothered. You just just laying in bed going, oh, it's so cold. I just don't want to get out of bed.
And I'm going into bed when it's cold.
And now you want to get out and actually start doing things.
How long after that done could you go back to work?
I had 4 weeks off, but I chose to have 4 weeks off. And my dad had his, and he went back a week after, but he's a driving instructor, so he was just sitting in the car most of the time anyway. It's normally about 1 to 2 weeks, I think it is, for recovery.
Because what I did, like, I actually set signs that up to work.
Yep, yep.
The roadworks and that.
Yep,
yeah.
Yep.
So you're lifting signs.
Yeah.
Some signs can weigh 30 kilo.
Well, that's right, yeah. See, no, like within retail, I lift furniture and all that all day, and it did get difficult at that stage, and I had to say, no, I can't lift that sort of stuff. Not yet, anyway. And now it's all just fine. It's just brilliant. And with food and eating, I have to eat. I have to make time to eat. If I don't make time to eat, I do become sick, really sick, and it's more cramping. You feel that you just want to you need to eat, even if it is just half a banana or just something like a handful. Normally I have almonds at work, and I normally keep them around in my pocket and just have a few every now and again, and that satisfies me now. And it's
But you say preparation as well. I think I found that you go from a bit snackish to hungry to feeling sick really quickly.
Yeah.
So have something there. Just be smart about it. The girls all here will certainly agree. There's Ziploc bags everywhere that I go. You can see where I have been. A couple of nuts in that one. I've got half a muesli bar in that one, and some almonds in that one, and some dried fruit, some yogurt balls. I've just got them everywhere, all through my car, my house, work, because when you get that little bit peckish, you just have to satisfy that. And instead of later on going, oh, I'm starving, and then popping down your food too quickly, which will also make you sick. So I think it's just being prepared, having those little snacks around, and just being more mindful that you've got something to grab when you need it.
Yeah, my house is full of snacks at the moment. It's kind of scary.
A question for you, because you had the ghrelin hormone removed, did you notice a significant difference in hunger?
Straight away.
Wow. You had to actually think about eating. It's not, I'm hungry.
When I first had the operation, it was like you just didn't feel hungry at all. And then once I got over that, the smell of like my favourite foods, it started to drive that a bit. But then once you got closer and had a bit of it, you go, oh shit, I can't eat anymore, and it stops that. You can't eat that anymore, and your stomach and your head's got to work together.
I'm one of those, like, if I'm not hungry, I won't eat.
Yeah.
But then when I do eat, I'll have like a big plate of chips, big steak.
Yeah. I love my steak as well. I loved my steak. Now, I'm lucky to have the steak. Chicken is a staple for me at home at the moment. Chicken. Ham, pork is I feel pork is it's still a bit hard for me to have pork. I love pork. Pork's one of my favourites. But it's still a bit. I still got to get used to that sort of pork and all that sort of the hard foods and that.
Did the psychology side of it, speaking to a psychologist all the time and a dietitian, having that support network, did that just make it really easy for you?
A lot easier. To have someone to talk to.
Just like you said before, getting your head around it.
Yeah.
Obviously you need that support to get your head around it. So you found that fantastic.
Yeah, absolutely. And the support here is just fantastic. And the support that I got from my family was even just as fantastic, to have that sort of support. And with work and all my regular customers that come in, some people that haven't seen me for 12 months and they don't even recognise me. They come in and they go, oh my God, who are you? You know, and it's just, they just don't, yeah. And then you tell them and they go, oh, that's fantastic, well done, you know. But before I was telling people that I was going for this operation, I had massive negative about it. It does happen, you know.
No,
Yeah.
any kind of thing.
Anything, yeah. You got that, but you just go, whatever. It's my decision, I'll do it, you know.
Well done, it's great.
Thank you.
Congratulations, you've done really well.
Thank you very much.
Thank you.
Yeah.
Fantastic result to be able to share with you tonight, and wonderful to see Lou here. Any questions, you're more than welcome to approach any of our team. I have one last offer that I've actually given to people who've attended seminars over the last couple of months, but this is actually the last time that we'll be doing it up until the end of this month. So if you really like the idea of the support program, we offered it spontaneously to a group of people here a couple of months ago, and it was an extended 2-year program for anyone who's going ahead with their procedures, but we're not doing it beyond 30th of June anymore. But it does give you, I think, a full 2 years of access to the support program. Who here really feels as though the support program is important to them and can understand the value? Yeah, you're so right. And we just see it every day, and it's so rewarding to watch and to see those results. But you know, right through from 6 weeks through to the end of that first year is just phenomenal, and it's very exciting for us. It's a really positive, exciting journey. So in spite of all the negative complications and associations that that you think about when you're dealing with morbid obesity, the other side of the equation is when we see people achieve such incredible long-term outcomes post-surgery. So it's a really rewarding area for us to work in, and we get a lot of pleasure from working with people. Please thank all of our team. It's great to have them here. We just love everything that they do for our patients. And if you'd like to if you're keen to make an appointment and you think that the support program is something that's going to make a huge difference to you in your life and you're ready to take that next step, I would really encourage you to come along and at least have that conversation with the surgeon. You've got nothing to lose. So please make the most of the opportunity, and thank you all for joining us tonight. And thank you to our online viewers. How did you find that? Yeah, sorry, you didn't miss a lot of the so I don't know what